May is National Allergy and Asthma Awareness Month and National Women's Health Month. We know that there are so many ways that our health is impacted by asthma and allergic disease. But did you know that asthma is a risk factor for herpes zoster? Yes, herpes zoster, known as shingles, which is the reactivation of the virus that causes chickenpox. But let's go a little bit deeper. More adult women than men actually have asthma, and women are already at greater risk of herpes zoster just for being female. The risk also increases with age and with conditions a woman may develop, like breast cancer or endometrial cancer. But let's stay on asthma. I'm bringing in another asthma specialist, Dr. Rutland, to discuss why herpes zoster has an increased risk in asthmatics. He's a little bit of a nerd, but his explanation is necessary.
Oh, it's necessary. Why asthma, though? We all understand that asthma is chronic inflammation of the pipes that carry air to the lung. We treat mostly with local inhalers that have an inhaled steroid as a component. But why are asthmatics specifically at risk? It turns out that most asthma is caused by an upregulation of Th2 inflammation. This creates an imbalance of Th1 and Th2 inflammation. Asthma patients experience reciprocal Th1 insufficiency. Varicella-zoster virus specific Th1 immune response is thought to be the primary driver in preventing varicella-zoster virus reactivation. Data also shows a correlation between varicella-zoster virus cell-mediated immunity response and the severity of shingles and occurrence of postherpetic neuralgia.
Hey, sorry Jamie for butting in. These are people like myself who have asthma. I've seen the impact shingles has had on my patients. It's caused by varicella-zoster virus, a double-stranded DNA virus. This virus likes to infect epithelial cells, T lymphocytes, and nerve cells or ganglia. The first time someone is infected, they develop chickenpox. After primary infection, the virus becomes latent and hangs out in the nerves. It is uncertain what exactly leads to reactivation, but when VZV reactivates, it does so in a dermatomal distribution and leads to the characteristic vesicular rash that lasts for 2 to 4 weeks. This is shingles. One of the major complications is postherpetic neuralgia, which is pain that persists for at least 3 months after the onset of the rash. As you can imagine, this is no fun. There are other complications like herpes zoster ophthalmicus and zoster paresis. In rare cases, meningoencephalitis and vasculopathies can occur. We need to understand which of our patients are at increased risk of shingles, which is why you and I are here to raise awareness.